Well, we were looking at a piece not long ago talking about hospitals around the country, including right here with MercyHealth, are reporting fewer visits for heart attacks, acute strokes, other medical emergencies. Not clearly understood, and studies are underway. And we thought we would kick this around a little bit with Dr. Jason Bredenkamp. He's chairman of the Department of Emergency Medicine at MercyHealth's Javon Bay Hospital. Doctor, good morning to you.
Good morning.
How's everything going this morning?
No complaints.
I'm glad to hear it. And by the way, just on a personal note, a tip of the cap to the folks at Department of Emergency Medicine at Javon Bay. That's where we were with my daughter not all that long ago after suffering an acute liver injury. And you guys could not have been better. And the highest possible praise I would like to bestow on you because you made what was a tough situation a lot easier to deal with.
Oh, glad to hear that, and I hope she's doing well.
Thank you very much. I appreciate that. What kind of emergencies always warrant a trip to the emergency room? Because that gets kicked around in a household. Is this ER worthy? Is this something we should call and make an appointment? Do I need to get this looked at right now? Obviously, if you're hemorrhaging all over the floor, then that would be a qualifier. But where do people get into that? Should I or shouldn't I?
Yeah, it's a good question, and it's a frequent question. Sometimes it's hard to answer. So just generally, I would say if you're not sure, you should always err on the side of caution and just go to the emergency department. But things specifically that catch our attention and that you should seek medical treatment for in the emergency department immediately are certainly any stroke symptoms, so facial droop, slurred speech, weakness, numbness, tingling in an arm or a leg. Chest pain, especially dull, aching chest pain that's worse with exertion, any type of shortness of breath, passing out, abdominal pain, severe headaches. These are all things that you should come to the emergency department for.
And is it better really to go to the emergency department and be told, look, this doesn't really qualify as an overall emergency. We'll get you booked in with your primary and get that taken care of rather than take the chance that you're wrong?
Absolutely. So, what we do in the emergency department is essentially medical screening exams. So it's our job to determine whether or not you have an emergency medical condition, and if so, treat it. With that said, even if you show up to the emergency department and it's not something that, is serious or significant, we're still going to take care of you and always make sure that you have follow-up. So, we take everybody, all comers, through the doors in the emergency department.
So nobody yells at you and, thanks a lot for wasting our time. Get out. It's one of those that, of course, they're going to look you over and make sure that, this isn't something to sweat.
Right. If anybody ever yells at you or chastises you for coming to the emergency department, I'm going to hear about it, and it's going to be addressed.
Okay. And just the way you said that, I have absolute faith that that's true. What should people expect when they show up at the emergency room? There have been plenty of people who have made a trip at one time or another, but there's also plenty who have never set foot in one.
Yeah, so it just depends on what emergency department you're going to, what time of day. You could very easily walk into the waiting room and see 10 or 20 people. You could also walk into the waiting room and see no people. And keep in mind that what you see in the waiting room is not necessarily reflective of what's going on behind the doors. But these days it's a little bit different. When you come to the emergency department, the first thing we do is give you a mask if you don't already have one. We're doing our best to honor physical distancing in the emergency department waiting room. We are restricting visitors that accompany you within the emergency department. Now, granted, parents, of course, come back with kids, and anybody that needs a health advocate with them certainly can come back into the emergency department. But we're doing our best to mitigate the spread of COVID, and I have to say that right now I feel safer in the emergency department than I do anywhere else. Just because this is our wheelhouse, we know how to prevent infection spread, and we're all masked, and you're all masked, and our cleaning processes. It's just, in my opinion, a very safe place to be right now.
Hey, Doctor, a quick follow-up on that question there. Obviously, things are a little bit different right now, but let's say, 15 years ago, I made my trip to the emergency room. What generally has changed in emergency room procedure from like 15 years ago to if we were normal today, what's going on today?
Yeah, I would say probably the biggest thing that's changed is the electronic medical record. So that probably has been the biggest single change in my 20 years that has allowed us to improve the care that we give to patients. So if you come into our emergency department at MercyHealth, Javon Bay, but you get your regular care at Swedes or OSF or really most anywhere else, I'm able to pull up those records, see when your last blood work was, see when your last chest x-ray was or last EKG, and that has really improved the continuum of care and has allowed us to treat patients far better than we did 20 years ago.
We're spending some time with Dr. Jason Bredenkamp, emergency care specialist at Javon Bay Hospital and MercyHealth's Javon Bay Hospital. Does a fantastic job, and as I said, I can attest fully as to the expertise and the great people they have working the emergency room there. We kind of touched on this, but to lay it all out, why you shouldn't wait for emergency care. A lot of people, just give me a few minutes, I'll be better.
Yeah, that's, it's everybody's individual. Some people try to tough things out and are very stoic. Others have a much lower threshold for coming to the emergency department. And as I stated previously, if you're on the fence or you're not sure, you should just come in and let us decide. There's lots of things, even if we don't do any testing, there's lots of things that we still do in the emergency department. We take your vital signs, we examine you, and just because, you're not getting a $1 million workup doesn't mean that it's not a valuable visit. And so I would encourage anybody who's suffering from the things that we mentioned previously to not hesitate, to not wait, to come on in. It's safe right now. We're open for business. And ready to take care of you.
But this is an actual phenomenon, though, of people that you guys have noticed are holding off on those visits where normally they would have come in to have you look them over, but either they're afraid, they think that unless it's a COVID-19 related thing that they can't come in, any number of reasons, but something's going on, isn't it?
Right. So remember at the start of the pandemic, the big push was, I'll come into work for you, you stay home for me, that type of thing. And the reason that we were doing that was to, quote unquote, flatten the curve. So that in the case of like New York, where the healthcare systems were just getting overrun, that's what we were trying to prevent here. And to some degree that worked. We had a lot of mitigation in process prior to COVID hitting here in Rockford, so we never really got that surge. But despite that, we saw anywhere from 40 to 45% reduction in our ED volumes over the last 3 months, and that's pretty consistent with nationwide numbers. But even more concerning is heart attacks, strokes, even appendicitis. Presentations were down nationally in the emergency departments, and so that's concerning. The thought then is that people are staying home and not seeking care in a timely fashion, and we've seen that in the emergency department. We've seen people that have come in and their heart attack or their stroke has been completed, and now they're suffering the secondary effects of that. So the message today is, you should come to the emergency department. If you feel like you're having an emergency, you shouldn't be scared of COVID-19. It's a safe place, and I think that we're past that worry of a surge. So doors are wide open.
Outstanding. And doctor, before we let you go, you speak with obvious pride about the emergency department there. What else would you like to tell us about it that maybe people don't know?
Yeah, I am. I've been here since 2001. I grew up, so to speak, with the former Rockford Health System and have been a part of the transition to MercyHealth. I'm very proud of the 28 physicians that we have in our emergency departments at MercyHealth Javon Bay. They are all residency trained and board eligible, board certified in emergency medicine. And I say with confidence that anybody who walks through our doors in the emergency department is going to get the highest quality of care.
He's Dr. Jason Bredenkamp, Chairman of the Department of Emergency Medicine, MercyHealth's Javon Bay Hospital. Dr. Bredenkamp, thanks for taking time out of your busy day. We know how things are very busy across the board. Thanks for carving out a few minutes for us. It was very educational, and we appreciate it.
Thank you. Pleasure was all mine.
Have a great day.